Hello, this is chapter 17, and this is covering life cycle nutrition, focusing on adulthood and the later years. These are your learning objectives, and I just want to note that I believe the text defines older adults as those who are 65 years and older. Observation of older adults. So you have physiological versus chronological age. So chronological age is the person's age in years from their date of birth. Physiological age is a person's estimated age based on their body's health. These habits seem most influential on health, so eating a well-balanced meal, engaging in physical activity daily, not smoking, not using alcohol or only using it in moderation, maintaining a healthy body weight, sleeping regularly and adequately, relieving stress, focusing on a sense of purpose, and having a community of family and friends. The aging process. The older you are, the longer things have influenced your health, be it diet, genetics, activity, etc. Psychological and physical stressors. So, physical stressors include things like drug and alcohol use, smoking, pain, illness, etc. And psychological stressors would be exams, a divorce, death of a loved one, or moving to a new city. The body's stress response. You have nervous and hormonal systems respond to stress. Prolonged or severe stress on the body can leave the body weakened, aged, and vulnerable to illness. We don't want to stay in a heightened state of stress for long periods of time. Body weight. Approximately 35% of older adults are obese. Being moderately overweight may not be harmful. For adults over 65, the BMI range with the lowest mortality rate is 23.5 to 27.5. Underweight in older adults most commonly reflects malnutrition. In general, older people tend to lose bone and muscle and gain body fat. As for older adults benefiting from having a slightly higher BMI range, as mentioned 23.5 to 27.5, some extra body weight is good to protect you from illness or injury, be it pneumonia or a broken hip. Without extra fat stores, you may not be able to fight off disease or heal injuries as well. Nutrition status. Factors that influence nutrition status and overall food intake in the older populations include GI tract, motility, constipation. So motility slows down, intestinal walls lose strength and elasticity, and constipation is common in this population. Medications can cause things like dry mouth or interfere with absorption. Dentition, so that's like how well your teeth are, if you have teeth or dentures, whatever that might be. If you have poor dentition, you might have difficulty chewing. And if you can't eat, you want to consider things like the cost of dentures, or if you have dentures and then you lose weight, the dentures don't fit as well. So those are all problems you might see in the older population. Psychological factors like depression and loneliness, you can find that they might have a decreased appetite if they feel lonely, if they lose a spouse, or if they're worrying about their finances or what the future holds. Decreased taste and smell will decrease their desire to eat. And then dysphagia is swallowing difficulty. And this often is associated with strokes, but also it can occur with old age. So sometimes what they'll do is you'll have maybe like speech therapy work with a patient and they'll trial them with different liquids to swallow. And sometimes they require to be on what are called thickened liquids, and they could be honey thick, so like a honey consistency, or nectar thickened liquids. So they're thicker than water. It's um, a lot of times patients don't really like it, but they might need to drink that for safety purposes and making sure that when they're swallowing, it's going into their stomach and not into their lungs. But sometimes you end up with this older population on those types of diet. They're modified, whether it's the liquids or if they're on puree, something like that. They don't want to eat it, and that can lead to factors like dehydration and malnutrition. Tooth loss and other physical problems. So good dental care over a lifetime is important. Older people may have lost some or all of their teeth. Difficult and painful chewing. So dentures may or may not fit, especially if you have weight loss. The dentures tend not to fit as well anymore. And in a hospital setting, they may or may not bring them to the hospital. They may forget them. You don't want to lose them. They're very expensive to replace. Those are things you might want to keep in mind. Also, limited food selections. So if you have poor dentition, it's tough to eat meats or very hard foods. They may not like any sort of diet modification, again, like the purees, mechanical soft, ground foods. They might have to change the texture, and that can be less appealing to them. There's less dietary variety and lower intakes of fiber and vitamins. Sensory losses and other physical problems, so vision, mobility, hearing, taste, and smell. They can't see as well. They may or may not be able to feed themselves depending on the situation. They could have trouble opening bottles, opening lids. That could also hinder them from eating certain things. And then due to altered taste and smell, can cause a decrease in appetite as well. I ask that you pause this presentation momentarily so that you can try to match these accordingly. Water, thirst response, and dry mouth. So despite fluid needs, older people don't seem to feel thirsty or notice mouth dryness. This can lead to dehydration. Dehydration, total body water decreases with age. So even mild stressors like fever and hot weather can quickly lead to dehydration in the older population. Problems associated with dehydration include being more susceptible to UTIs, pneumonia, pressure ulcers, confusion, and disorientation. Prevention. You want to drink at least 6 glasses of water daily. The recommendation is 9 to 13 cups per day, but a minimum of 6 cups can help prevent dehydration. You want to emphasize beverages and fruits like melons for added fluid content. Water and older adults. This slide says much of the same as the last slide, but it is important nonetheless. So older adults are more susceptible to dehydration. Dehydration increases the risk for UTIs, pneumonia, pressure ulcers, confusion, and disorientation. Fluid needs are often not recognized. They may not feel thirsty or notice mouth dryness. Mobility and bladder problems can cause intentional water restriction. So this population may or may not be continent, meaning that they recognize that they have to go to the bathroom and are able to hold it until they can get to a bathroom or a commode. They may not be able to hold it for long, or they may not realize they have to go and they end up soiling themselves. So because of this difficulty, to get up and go to the bathroom, or they need help, assistance, whatever it is, they may prevent themselves from drinking as much as they should, specifically so that they don't have to go to the bathroom as often. Water recommendations: 1 ounce of water per kilogram of body weight, or 9 to 13 cups per day. Energy and nutrient needs of older adults. On average, energy needs decline an estimated 5% per decade. So as you get older, calorie needs decline, and this is due to reduced physical activity, and your BMR declines 1 to 2% per decade, in part because lean body mass and thyroid hormones diminish. Nutrient needs remain high, so you need to choose nutrient-dense foods. Remember, nutrient needs like vitamins, mineral, fiber, not necessarily needing more calories. Overall, needs do remain individualized, so you still need to consider activity levels, gender, lean muscle mass, catabolic illnesses, etc. Protein, 0.8 grams per kilogram of body weight. Energy and energy nutrients. So some quick facts for you. Protein is important for supporting a healthy immune system. It also prevents muscle wasting and optimizes protein mass. Sufficient carbohydrate intake protects against protein being used as energy. Whole grains, fruits, legumes, and vegetables provide vitamins, minerals, and fiber. This, along with water, helps alleviate constipation. Polyunsaturated fat provides valuable nutrients. Saturated fats increase the risk of atherosclerosis. Vitamins and minerals. Vitamin B12. An estimated 10 to 30% of adults older than 50 years of age have atrophic gastritis. Atrophic gastritis is a chronic inflammation of the stomach characterized by inadequate hydrochloric acid and intrinsic factor, potentially leading to a B12 deficiency. They may need fortified foods and supplements. Vitamin D is associated with osteoporosis and dementia. Older adults are at risk for deficiency because 1, they may drink little to no milk. 2, they oftentimes have very little exposure to sunlight. And 3, the reduced ability for skin to synthesize vitamin D and for the kidneys to activate it. Calcium protects against osteoporosis. AI or adequate intake increases for women. After age 70, it also increases for men. The increase in women is due to menstruation. Iron. Deficiency is less likely in older people, but medications can affect absorption. There's reduced stomach acid, and blood losses can lead to a deficiency. With the reduced stomach acid, it can lead to poor iron absorption. Nutrient concerns of aging. So I won't read these all to you, but you can see the nutrient listed on the far left, the effect of aging, and then comments about it as well. Looking at fiber, the likelihood of constipation increases with low intakes and changes in the GI tract. Adequate water intake and lack of physical activity, along with some medications, compound the problem. So this is a continuation of the last slide, and I am going to specifically note calcium. So intakes may be low and osteoporosis is common. Stomach discomfort commonly limits milk intake, and calcium substitutes or supplements may be needed. And that concludes chapter 17.